Our species has quite a dark history when it comes to the treatments of mental health. Only recently have we begun to understand these issues better, and even today, some mental health treatments are hotly debated. Also, only recently have these treatments been humane. In fact, not so long ago, the mentally ill were hardly treated as human at all. Terrifying mental health remedies can be traced all the way back to prehistoric times, when people thought that demonic possession was the cause for insanity. And what was the cure? Trephination. Trephination, or trepanning, is a process in which a hole is drilled in the skull, and with some skulls dating back to Neolithic times, it is one of the oldest surgical practices for which we have evidence. The earliest trepanned skull was discovered at a Neolithic burial site in France, and it is more than 7,000 years old. The bone that was removed may even have been kept by prehistoric peoples to be worn as a charm to keep evil spirits away. Many different civilizations, from the Romans to the Chinese, performed this procedure, using sharpened pieces of flint as a surgical tool. While being useless in curing epilepsy and so-called madness, in some cases it did have real medical benefits. For example, reducing pressure by draining excess blood from the skull, especially after a battlefield injury. But with zero anesthesia, this made for a particularly painful and even life-threatening procedure. However, apparently the survival rate of these operations was surprisingly high. And then throughout the Middle Ages, there were all kinds of mind-boggling remedies, and the medical treatments often did more harm than good, which I'll be covering in another episode, but for now we'll stick to psychiatry specifically. So let's head to the mid-1700s when we come to the age of the asylum, when the technology has changed but the brutality remains. This is when asylums became notorious warehouses for the mentally ill. According to Jeffrey A. Lieberman in Shrinks, The Untold Story of Psychiatry, quote, "The purpose of the earliest mental institutions was neither treatment nor cure, but rather the enforced segregation of inmates from society. The mentally ill were considered social deviants or moral misfits, suffering divine punishment for some inexcusable transgression." Unquote. The function of the mental institution was simply to keep the inmates in custody. The keepers were little more than guards, and it was not uncommon for patients to be kept in chains or other restraints for most of the time. The extent to which restraints were used varied from one asylum to another, but they were accepted as a necessary part of mental health care. Although they call these restraints, today they look nothing short of torture devices. Here's an example of a restraint found in a trunk at the Hanwell Asylum in the 1930s. It is thought to be from the 1700s, and we can see the long sleeves to keep the patient's arms restrained and the leather straps around the face to prevent biting. In 1829, William Shrivinger, a patient at Lincoln Asylum, was found dead from strangulation after being strapped to his bed in a straitjacket and left overnight without supervision. The incident persuaded the authorities at Lincoln to abolish all physical restraints and implement a non-restraint system. Their system was very influential in the 1800s asylum reform, and indicative of a wider change in attitudes towards mental illness and the care of mentally ill people. William Tooke founded a private mental institution outside of York called The Retreat. He and his grandson Samuel believed that the patients benefited from being treated as ordinary people. They were expected to dine at the table, make polite conversation over tea, and do regular chores. The role of the alienist, or psychiatrist, was to encourage rational behavior. The system relied on rules and constant supervision, enforced by simple rewards and punishment. Although the attitude towards caring for the mentally ill changed from this point on, as we head to the turn of the century, the patients go from prisoners to guinea pigs. During the 1850s, drugs such as chloroform, bromides, and ether were increasingly used to subdue patients. Henry Cotton, who was superintendent at New Jersey's Trenton State Hospital from 1907 to 1930, thought infected parts of the body led to mental illness. He focused on pulling rotten teeth, which he thought caused madness-inducing infections. When that didn't work, he assumed contaminated saliva still made its way into the body. Cotton then began removing tonsils as well. And then this so-called doctor took it a step further, removing parts of the stomachs, small intestines, appendixes, gallbladders, thyroid glands, and particularly parts of the colon, any place where it was thought that infection could linger. Unsurprisingly, it didn't work, and killed a lot of people. Another widespread treatment was hydrotherapy. Introduced in the 1890s as a treatment for typhoid fever, it was later applied to the treatment of various neuropsychiatric disorders. It involved immersing parts of the body in a full tub of cold water for an extended period of time, on the belief that the cold water drew the blood from the diseased body parts and effected a cure. The various types of treatment included the plunge, douche, shower, hose, cataract baths, the rubbing wet sheet, and the sitz bath, in which the patient sat waist deep in ice water for 15 to 20 minutes with a blanket thrown over the shoulders. The next fad in psychiatry was insulin shock therapy. Insulin shock therapy, or insulin coma therapy, was a form of psychiatric treatment in which patients were repeatedly injected with large doses of insulin in order to produce daily comas over several weeks. It was introduced in 1927 and used mainly in the 40s and 50s for schizophrenia. The idea was to shock the brain into a sort of reset, and was tried again and again over the course of years. Although compared to others it seems less invasive, this was a living nightmare. Patients were constantly in and out of comas. There was never any serious evidence that insulin coma therapy had any effect on patients whatsoever, and it was later replaced with other, more successful drugs. Finally, this list wouldn't be complete without the lobotomy. The history of the lobotomy is a long and horrible one. Today, the treatment is considered to be one of the greatest mistakes of modern medicine. The objective was to sever the connection between the prefrontal cortex and the thalamus by using a surgical instrument, an orbitoclast, to cut through the thin layer of bone above the eye socket. A small hammer was used to drive the instrument into the brain. In some cases, it was then scraped from side to side. When it was first introduced, the lobotomy was hailed as a cure-all and widely recommended by physicians. The purpose of this treatment was to provide relief to people with mental illness unresponsive to standard treatments. Doctors believed that severing the connection between the frontal cortex and the rest of the brain, particularly the thalamus, would reduce abnormal stimuli from reaching the frontal area. Such stimuli were thought to cause compulsive or violent behavior. A lobotomy would make the patient calm and docile, so that they could be sent home to live with their families. Although there are cases of this being a successful procedure, many patients were not so lucky. John F. Kennedy's sister, Rose, was famously subjected to this horrible treatment after fear that her mental health issues and promiscuous behavior would cause problems for the family's political aspirations. She was told to recite poems and sing while the operation was underway. Only when her speech developed into mumbles and then finally stopped did the doctors stop scraping from side to side. The operation was an abject failure. Not only did the operation provide no cure, but it made her disabilities much, much worse. She was then hidden away and ignored by the family. The Soviet Union was the first to ban lobotomy. Soviet doctors concluded that the procedure was, quote, contrary to the principles of humanity, and through lobotomy, an insane person is changed into an idiot. Thanks so much for watching. In the future, I'll be coming out with some true crime, weird history, and some paranormal content. If you enjoyed the video, please like and subscribe. As a brand new channel, any support truly helps. Be safe out there. Good night.